3D printing is, I think, one to definitely watch for the future. I always like to conclude this lecture at the AAD with where I think we are going and some exciting new technologies. 3D printing is tissue engineering that can be used to fabricate three-dimensional artificial scaffolds. This is to create a microenvironment that mimics the human tissue. We can not only mirror the structural aspects of the skin, but we can also mimic the compositional and the functional aspects. And that can be very powerful as a tool therapeutically and also investigatively. In my lecture, I mention one review paper that looks at the potential of 3D printing in dermatologic surgery for reconstructive surgical procedures to facilitate wound healing, for skin grafting and skin scaffolds, and for tissue reconstruction. So I think that if we think where we are going to be in the next few years, this is going to be an arena that's really expanding. We are going to see some very exciting new developments in the field of 3D printing.